The exercises discussed in this video attempt to bias the lower trapezius muscle. This part of the trapezius originates on the spinous processes of T4 through T12 and inserts on the scapular spine, medial to the anterior-posterior axis of rotation. Based on this orientation of fibers, the lower trapezius will work to retract the scapula. With the coactivation of the rhomboids, upward rotate the scapula. With a force couple, help of upper trapezius, and depress the scapula inferiorly. The lower trapezius helps to counteract the excessive force dysfunction produced by the upper trapezius in pathological shoulders, and is incredibly important in the proper scapular rhythm for functional overhead and pulling motions.
The following sets of exercises are consistent with the manual muscle test that attempts to bias the fiber directions associated with the lower traps. The moderate variation is essentially what we know as the manual muscle test, with the patient lying prone and raising the arm in a parallel direction concentrically with the fibers and thumbs up. If the gravity-dependent position is too difficult, we can further reduce this by sitting the patient up or standing. The end phase is the most important regarding the activation of the lower traps. Additionally, if not difficult enough for the patient, we could add a component to incorporate more dynamic stability in the exercise, such as demonstrated in the standing TheraBand WADs. Make sure the patient does not attempt to substitute via rotation through the trunk as seen here.
As a moderate level variation of the TheraBand row, we can change the line of pull for the resistance band to incorporate more of the retraction and depression components of the lower trapezius's fibers. Here the band is placed at an angle such that the shoulder starts around 120 to 135 degrees of flexion and pulls back and down with the shoulders. To make this motion a little easier, we can place the patient standing with their back against a wall and trying to simulate the same motion with retracting and squeezing the scapula inferiorly. To further increase the intensity on a similar motion, we could place a patient on a cable pulley machine with the lat attachment and have them perform a pull down at a slight reclining angle similar to the pull down exercise. Making sure the patient works to squeeze the scapula back and down will be crucial for the activation of the lower traps throughout this exercise.